We'll call the Human Services Committee to order. Thanks everyone for being here. First item is approval of the agenda. Chair will entertain a motion.
So moved.
Support. Thank you. Moved by Snell and supported by Bear to approve the agenda. All in favor will please say aye. Aye. Any opposed? Thank you. We're up to public comment. Is there any public comment today? Any public comment? We're at public comment in case anyone has public comment to make. Seeing no public comment at this time, we'll move on to committee items. First is committee item 4A, the approval of the minutes of last month's meeting. The chair will entertain a motion.
So moved.
Thank you, Commissioner Snell, and supported by Commissioner Alexander. Any comments on the minutes of last month? All in favor will please say aye.
Aye.
Any opposed? Thank you. We're up to the medical care facility quarterly report. I'm not seeing anyone from the medical care facility here. Whoops, did I miss appointments? I beg your pardon. I missed the appointments that yes.
In the absence from anybody from the medical care facility, can I ask a question? They perpetually seem to be losing money. Is the county mandated to fund and operate a medical care facility?
Last administration to respond to that question.
We are not.
We could sell it and privatize it. Okay.
We kind of skipped over appointments. I beg your pardon. It's because I think I recall, and it's true, that we have no appointments to make this month. We will go on to now anything further with respect to the medical care facility. I will let the committee know that the medical care facility, or the Human Services Board, did meet last week, and Deb Kubitsky and I attended that meeting. They had a lengthy discussion of budget amendments for the medical care facility. I recall the numbers being about 1.7 million or so reduction in what they expect their income to be for the year between expenses and revenue. They had a lengthy discussion about that. So they're concerned with how to go about kind of balancing their budget. And more recently, they have had the advantage of PPP loans and employee retention credits that have bolstered their income, but those are one-time items that, of course, they won't have in future years. So the question, Commissioner, is an excellent one to know whether, on a long-term basis, the medical care facility is sustainable. Did you have a question, Commissioner Snell? Commissioner Snell, please.
Thank you, Mr. Chair. And I'd like to add to Commissioner Bear's comments there in question. I've always wondered, and I thought we'd asked this, and I don't think we have ever got an answer. It was like, at what point, at what level of service, how many patients inside will it take to get to that point where we're not in a negative balance, where there's some equilibrium, and I'd like to get an answer on that. And I know it's not necessarily an easy answer, but I mean, I think we have a responsibility to our taxpayers to assess where we're at and what we need to do to get to that point where we're not in the hole on that facility. Thank you.
Did you want to comment?
Deborah, do you want to?
I'm actually having a hard time hearing you.
I was going to suggest that Deborah could probably answer that question. She attends the meetings, and I know they had a discussion about that, as Earl indicated at the last meeting. as to the number of beds, what they base their budget on, and of course what that means for break even, as well as what their what the suggestions were, I believe, to remedy their deficit. You could probably at least throw it out there. They haven't officially asked for any of these, but they discussed it, I believe.
Yeah, the meeting was a very robust discussion on they're aware and trying to resolve some issues with their budget, so it was a great conversation. Right now, part of the problem they have, it's kind of I call it a circular problem, because one thing leads to another, but you can't just fix one thing to make it work or to fix the problem. So they're having some staffing issues, and the staffing issues result in them limiting their bed space, their census numbers, which then reduces their budget. So they need staff to take care of the patients, but they can't find staff, and then now they're having referral issues, so they're not getting patients either. So I believe their capacity is approximately 194 beds. Right now, they're at 154, so they're significantly under capacity. But the meeting, there was like I said, a robust conversation. Some of the items that they were discussing towards the end of the meeting were the millage. They have a millage that goes through 2030. There was some conversations about increasing the millage. There was conversations of increasing the pay for nurses to perhaps recruit more talent. And better retention of their staff to reduce their turnover rate if they increased to a higher pay and more competitive market. But that's solving spending the money, so they have to figure out how to get the money too. So, but from what I understand, it's a very complex formula that they get depending on how the person is paying. A private pay, a Medicaid bed, a Medicare bed, private insurance bed. So they get different rates for all these beds, and it's a very complicated formula on how they can break even. So I don't know a number to break even, but I do know they're at 154 and they're not breaking even. So I can speak to that.
I would just add that, frankly, the break-even analysis, if you think about the math on that, it would be, there's a lot of moving parts, but it's not just the beds available, it's how much their expense side is, how much cost, how many stars are they promoting. I say stars because that's like, think of a hotel chain with, a 5-star hotel. It means they have more labor. So if you have less labor and you can't provide some certain elements of service, you might be a 3-star, which will affect people's desire to stay there. So they could break even with 154 beds. They just got to reduce their expense to make that happen. But realistically, it's a trade-off. You do that, and less people come there. And like Deborah said, it's a circular argument that it goes up and down. So it's a struggle for sure, and it's something we're going to have to watch closely. And frankly, more likely than not, based on our last 5 years of experience with them, that we may have to take some action at some point.
So they're not here to pass along their thoughts. I see that they normally make a quarterly report. I guess I would ask administration to ask them to show up next month to make a report, because these are substantial questions that we need to understand the thinking at present. So that.
Thank you.
Okay, thank you. We'll move on now to the Veterans Affairs Semi-Annual Report. Thank you for being here today.
Good afternoon. Phil McCaskey, for those of you who don't know me, I'm the department head over at Veterans Affairs. Our semi-annual report, we have some highlights here on some of the things that are going on within the office. Our current Veterans Board is fully staffed with the 4 members that are required. We have assistance with the American Legion that comes in 2 days a week, sometimes 3 on a Wednesday, 1 Wednesday a month they come in. They've been very generous in providing a service officer, which helps with the caseload that we have within the office. This past Veterans Day, our Memorial Day, we helped distribute out 15,552 flags to the respected organizations throughout the county for grave marker placement on all the cemeteries within Jackson County, which is a huge kudos to you folks because you are the ones that approve it's in our budget, and I appreciate that, and I know the veteran community does too. So I'd like to thank all the commissioners for the approval of that in our budget. We've answered in this quarter 1,133 phone calls. That's a lot for two-person office. It was a one-person office for almost a year once we had the retirement of Sherry Sawyer, but we recently put on administrative assistant Lisa Laporte, she worked downstairs in environmental health and she moved upstairs to the open position. Much needed and a great asset to the office. I mean, this is something that her knowledge, well, she doesn't have a knowledge, she cares, and that's, half the thing. And she's already taken the bull by the horns and is answering phone calls and directing people to the resources within the county and the federal side too. So huge asset to the office. Looking forward to seeing where we go. We have training coming up here in August, taking her to a training seminar through the American Legion and the state sponsor through the Michigan Veterans Affairs Agency, and she's going to grab a lot of knowledge there when it comes to Veterans Affairs. We've had 252 appointments scheduled within the office, and she went through the undaunting task of going through Civic Plus and getting her accreditation through the American Legion, so she isn't accredited. She has just the same accreditations as most. I mean, she's going to be huge when it comes to our office. And she's very well orchestrated within the IT based. I mean, does a lot of things that I didn't know were possible. When it comes, I'm not the computer guru, but I consider her as that person. If you look at the graphs that we have within the appointments, she broke it down within.
Just a second, who's managing the PowerPoint?
Am I supposed to?
We just want to make sure we're on the same page as you are. There we go, that's what you were
There you
just
go.
talking about. Now if you're talking about
Next
appointments,
one.
that's the next one, yeah.
There's the appointments. Basically, if you look at this, she's broke it down by the month, and each one of these colored graphs orchestrate what went on in the month. And when you go under consults, that's just everyday contacts, inquiries, people who call in the office or stop by the office. We have a, by appointment only type scenario within our office, but people can still stop by. They get some information, or we can set them up an appointment there at the office. Then if you look at the claims, claim work is anywhere from service-connected conditions or pension-based or aid and attendance benefits. And POA, power of attorneys, that's what we work on within our business. We have to have the power of attorney to access VA computer. So they have to grant us, which I work under the American Legion's accreditation. So 99% of all the work in our office is done through the American Legion under their POA. And only because in the last 3 years, we've lost 4 organizations. We've lost 4 organizations that no longer do this kind of work. Military or Purple Heart, the Marine Corps League, they've all left, closed their national offices down. So it's tough. I mean, the veterans are losing resources. And then go through these benefits comps. The EVRs is basically where a veteran's receiving benefits, pension benefits, and they can apply for additional benefits. And then it just breaks it down. She did a good job breaking it down. Burial markers, we're doing a lot of markers, a lot of burial markers for veterans. The month of June seems to be, I think weather was nice and they got out, and June's been very, very busy, June and July, so it's been very busy. Phone calls, we can go to the next screen. She's even broke this down to phone calls per month. So you can see we trend somewhere around the 200 mark a month in phone calls. And that's just, most of that's incoming calls. It's not the outgoing call, but we are tracking outgoing calls now. So that's one thing nice. She tracks everything within the office, and it gives us a little bit better idea where we may need to focus on some of our shortfalls if we, that come about. But other than that, the office is well-staffed and working every day. And I would invite any commissioner that would like to come out, kind of visit us any day. We're open every day, and you kind of see what we're doing. Tuesdays, I will tell you, Tuesdays is a busy day, which is nice because American Legion's in there Tuesdays and Fridays, but things really move forward on Tuesdays. It seems like that's where we try to focus our Tuesdays, our busy day, but the invitation's always open.
Okay. Questions, comments for Veterans Affairs? Mr. Administrator.
I was just going to ask, could you share with the board the nature of the calls and the duration, average?
Basically, probably the call, they average anywhere from probably 10 to 15 minutes, depending on the questions they have. But the most of the calls we have are, what benefits can I get? And, that's a big question. I mean, that's that big question. And then, you have to take the time down to ask them, when did they serve, what era, if they're a Vietnam veteran. Then we start going into the Agent Orange presumptions, talk about their health, try to get them talking about themselves to the point where we can try to assess if there are benefits. And so I would say probably 10, 15 minutes per call. And it's mostly what benefits are available.
So that translates, I did the math real quick there, it's 2-3 hours a day on the phone.
On the phone.
And I just for the board, benefit of the board here, that's 2-3 hours on the phone, and then there's at least that and then some, in fact, a lot more than that, really, now think about it, of paperwork for any one of those individuals who actually, so at first blush, I look at it and I go, what, 10 calls a day? That's not much. But when you really start thinking it through and knowing what they do and how much effort has to go into each application, it's a significant amount of time. They are busy people over there.
Commissioner Bear, please.
Good afternoon. Thank you for your report. To help people get a hold of you or people to come visit you, would you share with us your phone number and your address?
Yeah, our phone number over at the office is 517-788-4425, and our address is 1215 Lansing Avenue, or 1715 Lansing Avenue, I'm sorry, I was thinking something else. And we're right in the County Human Services building up on the second floor. Lisa's been doing some tremendous work on our website, and the website every day she's working on this thing, and it's really becoming a huge asset because all the information about us, to relieve some of the phone calls and that, there are some hyperlinks that she's put on there that veterans, like for instance, if someone's looking for a home loan certificate, they can go right on to home loans, click on this hyperlink, it'll take them right to the VA site, and they can do this process on their own, as opposed to coming to the office. So we're trying to mainstream things a little bit, which is a huge asset for us. And the website's, it took a little bit getting the things going, but it's definitely every day it's something different on there.
Thank you.
Yes, sir.
Commissioner Snell, please.
Thank you. I want to say I appreciate everything you do. My brother is a disabled veteran, 100% disabled, from Desert Storm. And you guys have always been there whenever he's had questions and that. And my son is also disabled from the other Iraqi war. And again, it's the support that you guys give that allows them to get the benefits that they're entitled to. So I appreciate everything you do.
Thank you. Yeah, I just wanted to add one thing. There was a phone call, particularly just today, about a lady who called me today and asked me about pension benefits for her mother. Well, she was approached by a company, she told me, and she says, well, they talked about a fee up front, and I said, oh, stop right there. The fees that these people are talking, they're lawyers. They are lawyer-based organizations that are putting all the TVs, commercials on. You see about the Camp Lejeune Water one's the big one right now. Those are all law firms that are charging veterans for services, and I told her, our office, this doesn't cost you anything for us to do this. We don't take a commission. They can take up to 33% of their retroactive benefit payments, and that's huge when you're talking disabilities. So it's definitely a free service. It's much appreciated, and, you know, people in the county don't realize that Jackson County is very veteran-oriented. There's a lot of veterans, and there's a lot of organizations within here. And our relationship with the Jackson County Veterans Council, which takes care of the parades, they do the fair, they have the Michigan-Vietnam traveling wall coming back to the fair this year. So we always go down there with them. We're open invite, and we answer a lot of questions at the fair. And it's nice that Dave Wellahan, who's in charge of that portion of it, has always had us invited down there, and, you know, it's a good relationship with them.
Anything, I don't know that I've seen publicized any flag retirements ceremonies recently. Does anybody do that on a?
Post 29, the Legion Post on Lansing Avenue, they actually, people used to bring flags to our office, and they'd come down and pick them up. Now they have like looks like one of those Goodwill containers in their parking lot where you can drop a flag off right there in there, and then they do the flag ceremonies as they get them, and they advertise within their body of their entity when they're doing them. So, yeah, that's the only one that I know of, but I think all the service organizations have some type of flag retirement, but post 29's who comes gets our flags.
Okay, very good. Anything further? Thank you for being here today. Appreciate the work you're doing.
Thank you.
And now the Department on Aging. I think I saw Danielle, you got a grant application request, it seems.
Good afternoon. And I just wanted to reference that the study session that the Region 2 Agency on Aging had put in there about their annual implementation plan, which was for the 23-25 multi-year plan for Jackson County. And this is kind of like a follow-up to that is our grant application. So what we're looking to do is to apply for the grants for the Region 2 Agency on Aging. It's something that happens every 3 years, and we're at the end of that cycle right now. So our new grant cycle would start October 1st of 2022 and then go through September of 2025. And so what we're looking to do is to be able to move forward with submitting grant applications, which are due actually on August 1st. There's 15 grants that we would be applying for. In the information that I submitted to you, you get an idea in some of the attachments as well, that we apply for over $1 million in grants, and these services go directly to help older adults and caregivers in our community through our nutrition programs, our senior centers, our home care services. So there's an array of services that we provide. So we're thankful for the dollars that can get flowed from the Region 2 Agency on Aging right down to the direct level of seniors in our community. Last year in 2021, the grant award captured 29% of our funding through the Department on Aging. And so what I'm looking for is something to move forward to the Board of Commissioners that would authorize myself to sign the grant application and then the subsequent statement of contract awards. It's not unusual that we might get 3 or 4 contract awards during a given year. Depends on how the feds release their funds and how the state releases it then to the Agency on Aging. So sometimes we might get a statement of contract award that might be for a quarter, might be through October or through December, and then we'll get another one for the next quarter. So it's not like we get a contract of award that would last for the full year. That's very unusual in the times that we've had right now, but usually it's based on a quarter.
Very good. Commissioner Bear, do you have a motion or question? Motion. Entertain the motion.
I would move that we authorize the Department on Aging Director to sign the Region 2 Area Agency on Aging 2023 to 2025 grant application and subsequent statement of contract award.
And supported by Commissioner Snell. Comments to the motion? Questions? Thanks, Danielle, for being here. And now to the motion. All those in favor will please say aye. Aye. Any opposed? Appears to pass. Thank you. And now on to your monthly report.
Actually, I have,
I'm sorry, you got a contract next.
I have a couple
Beg pardon.
things this month. It was a busy
You're
month.
busy today.
So, thank you for your patience. The next thing I wanted to bring forward is that we've been working with CoPro on our food service distribution contract. It's something I previously talked about here at Human Services. It's the relationship that we've had in the past with Van Eerden Food Service, and we're looking to be able to continue that relationship with Van Eerden. So CoPro had put out for a bid for a request for qualifications. There was actually only two providers that submitted the full bid process. A part of that deals with the economic times that we're in, where some of the companies are dealing with shortages and their staffing, and maybe they did not feel like they could commit to a contract, another contract with the Department on Aging. So what we're looking to do is to continue the relationship that we have with Van Eerden. The two bidders were Sun Valley and Van Eerden. When CoPro looked at the top items that we provide, or that we order through the Department on Aging, Van Eerden was about $60,000 cheaper than Sun Valley for those particular items that they submitted. That $60,000 was actually before we would look at, we usually get a 1% drop discount based on the size of the deliveries that we request. We also do a quick pay that's generally another 1% in savings, and then based on different products that we order, we get incentives back throughout the year. We'll probably get 3 or 4 incentives back. So recently we got, for the period of October through December, we just got a $1,000 check back for, it was actually about $960, so I apologize, not $1,000, $960 for products that we ordered through Van Eerden that had some incentives to buy those products. So we feel like we can continue to provide great service and meet the needs of the seniors. We've been happy with our food delivery. I think during the pandemic, we were dealt a lot with maybe some shortages or things like that. It was very, when you went to the grocery store, you might not be able to get items. I really felt like we worked well with our food purveyor in securing the products to make sure that we got the meals out to the seniors in the community. So what I'm looking to do is to get authorization to have a contract with Van Eerden as the primary food service distribution service for the Department on Aging for 3 years with the optional of 2-year renewal options.
Questions or action by the commissioners? Commissioner Bear, please.
I'd like to make a motion that the board authorize a contract with Van Eerden Food Services as the primary food service distribution service for the Department of Aging for 3 years with 2 1-year renewal options.
Is there support? Commissioner Snell supports. Further questions to the motion?
You should know that I worked for Van Eerden's for 7 years, but it's been 20 years, so I feel confident I can vote on this.
We'll waive conflict, Commissioner Snell. Thank you. Okay, if there are no further questions to the motion, thank you, Danielle, for bringing it to our attention. All those in favor will please say aye.
Aye.
Any opposed? Thank you. And now on to Senior Citizens of the Year.
Yes, the Jackson County Advisory Council went through the applications that were submitted for the Senior of the Year. And in doing so, they really felt there was 2 individuals that stood out for various reasons. And so the committee had decided to put forward 2 people to actually receive the Senior of the Year nomination for 2022. The first one was David Goebel. He actually had his application submitted from Elaine Crosby, who was the Director of Parishioner Engagement at Queens. There was great comments received during his letter about the things that he does to help with homelessness individuals in the Jackson community. He does homebound communion. He helps with the holiday dinners. There's a lot that happens that this Mr. Goebel does for individuals in Jackson County. The pastor at Queen says, I keep Dave Goebel on speed dial 24/7. Whenever there's a need, whatever the need may be, I know I can count on him to work the issues toward a solution. So very good comments received in the application, and that would be one that the advisory board wanted to move forward. The second one was for Karen Davis, and she does a lot with the hospice program and quilts. And when you think of just making them, there's so many things that happen behind the scenes, and when people are putting those together. And the committee that submitted her were actually her other volunteers that work with her to put those quilts together. So what Karen does is she picks out all the fabric. She launders the fabric. She delivers the quilts to the hospice home. She also is key in working with the hospital on something called fidget quilts. And so I had to bring one just so you could kind of see what it is. But they're more of a kind of like a little lap blanket, and they're very helpful for people that are in the hospital that may have dementia or some kind of anxiety, that they can play around with the different things that are on here to try to help soothe that person so that it makes their stay a little bit easier. So there's things like different fabric textures, zippers, snaps, and things like that. Again, all those little things that Karen and her group, and she takes the lead on that and gives back to the community. She's also very involved within her church, some veterans activities. She does a child study club, and honestly, every Tuesday, if you walk through the center, she's got her smiling face in there, and they're working on these quilts and also these fidget quilts. So again, those were two people that the advisory board thought were very deserving of this award, that we would like to be able to recognize them on August 8th.
Okay. Commissioner Snell.
Yeah, I'd like to move a recommendation that the full board approve these resolutions honoring Karen Davis and David Goebel.
And thank you, Commissioner Bear, for your support. Any further questions? Comment by Commissioner Bear, please.
I'm impressed with the number of quilts, over 5,050 quilts total. That's some busy people.
Yeah, was it 5,000 or 1,500, did that say?
Well, it says 3,500.
3,550, correct. Yeah,
Quilts
if you add everything together, correct, you are. Thank you.
It's at Henry Ford Hospice Home, and 1,500 fidget quilts for Henry Ford Hospital. So total, it appears to me, 5,050.
Yeah, and I think something else that's amazing about the quilts too that are given is that when they're at the hospice home, is that the families are able to take those quilts home to have something to remember of their time when that individual was there. So again, amazing work that they do.
Okay, and all those in favor of the motion to ratify with pleasure, I would add with pleasure, Commissioner Snell, if I might, the recommendation of the Aging Department. All in favor will please say aye. Aye. Any opposed? Thank you. Danielle, we sure appreciate the work. Continue with your monthly report, please.
My monthly report kind of captured a lot of the things that we went over. The one other thing would be the award that we received from Region 2 for the American Rescue Plan. I just wanted to touch on that we were awarded $331,112. And the time period for that statement of contract award actually went from 10/1 of 21 through 9/30 of 24. And we just recently received that. I don't see us having to use those dollars here in 2022. I really feel like the Department on Aging we're working within the budget that we have. I don't feel that we need to access those dollars this year, but what I plan for is to look at using those dollars in 23 and 24. So those dollars are submitted into the budget yet to be approved by the board, but I just wanted to let you know how we were capturing it and let you know that I feel like we're in sound budget plans for this fiscal year.
Thank you. I was going to ask, as we've kind of moved past the food contract, but I assume, I guess I'd like to hear you say it, that the contract we have recommended approval for is consistent with your budget.
Correct.
Okay. I also noted in your report that the Senior of the Year Awards will be at the county fair on Senior Day, Monday, August 8th at 11 a.m.
Yes.
So I would ask committee members to put that on your calendar if you can possibly be down there. They like to see county commissioners when they can to support our Department on Aging.
All right, thank you.
Anything further, commissioners, for Danielle? Thank you for the work today. You've been very busy today.
Yeah, thank you.
Thank you.
All right.
Now we'll move on to the Health Department. You have a budget amendment, I see.
Good afternoon. Yes, wanted to present a budget amendment. Primarily, what we're looking at with, I'm Jonathan McGowan, by the way. I think most of you know who I am. Work in finance and primarily with the health department. Primarily what we have is we had the COVID Safer Schools HRA grant, which was awarded after the initial budget process, so that was not included in our original fiscal year 2022 budget. And so that's about $436,000. So that is 100% grant funding for that program. It really was kind of late November when we really got that program fully up and running. So that's a pretty good chunk of it. We have a couple of the mosquito programs, and typically, as in the past, these are things that are on an as-needed basis. If there's a reported mosquito disease that is reported in the state, then typically that's when the funds are awarded for prevention purposes. So those are the primary ones that were kind of something that we couldn't budget for initially. And then the rest of it is primarily kind of shifting back to people to their kind of home departments that have been kind of diverted to a COVID response over the last couple of years. And so what you're seeing with some of these, like the health and nutrition grant early on, and with breastfeeding and medical marijuana oversight grants, is that these programs were maybe kind of back to full operation after kind of maybe partial shutdown due to COVID and resources being allocated elsewhere. So they're kind of going back to their home department. So what I'm showing on, like with the revenue side of it, is that in some cases where we were only projecting that we were going to use a portion of the grant, in most of those cases we're going to use 100% of those grant dollars. So we're not asking for any county contribution for any of these. These are all just kind of a reallocation of resources. So that's...
Commissioner Snell has a question.
Okay.
Well, I'd like to make a motion, if that's appropriate at this time. I'd like to move to recommend approval of the budget amendment and move this to the full board for approval.
And support by Commissioner Alexander, thank you. Further questions for the Health Department on the budget amendment? Commissioner Bear, please.
Yes, sir.
Good afternoon. Looking at your expense spreadsheet here,
Yes.
just in interest of making our budgets as accurate as possible, I see that a lot of the COVID Safer Schools area, there was no budget, there's just no budget for those items. And being that was COVID, maybe you didn't know things were coming up. But when you get to the type 2 water supply, that sounds like something that would be here every year, and yet there's no budgets or no dollars offered in this budget, in the original 22 budget. The vector-borne mosquito surveillance, there was nothing. The Eastern equine encephalitis virus, there was no budgets for anything. How was there no dollars put in the budget for those items?
Yes, thank you for that question, Mr. Bear. The Safer Schools HRA, the reason that was not budgeted for initially is that was a new grant. So even though it's a COVID-related, and we had some other COVID grants that were renewals, this was a brand-new grant, and it kind of had a different purpose of hiring some new people to go into the schools and assist with, so it is COVID-related, but it's kind of has its own kind of category, and it wasn't awarded at the time that we did the initial grant, and that's the reason we didn't know what the funding was going to be. We thought maybe it was coming, but we didn't know what the amount was, so we couldn't really budget for it in the initial budget. As far as the other questions, the type 2 water supply is an offshoot of the environmental health, and Don had requested that be accounted for separately, and so that's the reason we didn't budget for it in the initial budget, but it's just for kind of accounting purposes. And if you look at the revenue side, we have some increasing fees for environmental health that are covering that, but that's just for kind of accounting purposes, so that was requested to be accounted for separately, and that's the reason there's no budget, because it was initially part of environmental health, and we're just splitting that out for accounting purposes. And then as far as the mosquito grants, is the reason that we don't typically budget for that in the initial budget. Usually I think with both of these grants, the grant year started May 1st, so it's usually kind of a summer only kind of a thing with these mosquito grants. And so it's on an as needed basis, and so we don't typically budget for it because we don't know year to year if it's going to be awarded or not until we're maybe halfway through the year. So that's, hopefully that addresses all of your questions.
Yeah, that helps on my question. For next year's budget preparation, do you plan on putting something in there for the Eastern equine encephalitis virus? Or are you not going to put in it because you don't know what the grant is yet?
We don't know. I mean, for that particular grant, 2021 was the first year that was awarded, and so we weren't sure if it was just going to be a one-time thing or if it was going to be renewed or not. And so that's the reason that we're reluctant to budget for it, because we don't know until, they don't inform us until, like I said, maybe halfway through the fiscal year, whether it's going to be awarded or not. And so, and in particular with that one, that's federal funding, I believe, and we don't know how many years. It's just kind of a year-to-year thing, and it may or may not be renewed.
Okay. Well, as I stated, my interest is just trying to make our budget as accurate as possible. So
Right.
if there's any of these things that you can predict,
Yeah,
please have that put in the budget.
I'm reluctant to budget anything that is based on, it's not for sure that we're going to get the funding. You know, I mean, so there are some things like the mosquito-borne virus type grants that are, could be discontinued because they determine that it's not really a threat any longer, and so therefore we're not allocating any more funds. So we just don't know. We don't know.
Okay, thank you, Commissioner Bear, and we have a motion on the floor to approve the budget amendment. Any further discussion? All those in favor, please say aye. Aye. Any opposed? Thank you.
Thank you.
And now the Health Department monthly report. I see Kristen. Welcome.
Welcome, good afternoon. How's that? Better. I am here with my monthly report, and I will, we've got a lot of good things going on in the health department, so I will try to be brief but thorough in giving that information out. It's kind of like we've reached the point where, you know, as Jonathan mentioned, that, you know, a lot of those budget amendments, you're seeing movement within those departments because we didn't know what to expect, and now we're utilizing the funds that are being allocated through those grant programs. So this is the first report that I have moved the community health section of the grant, or excuse me, of my report to, so we swapped. WIC normally started out the report and it moved down to the PPHS section. So we have taken that, before I jump into the actual activities, we've taken everything within the organization structure that was previously approved in May of this year. We are, you know, now all underway, working under those realms with the swapping of departments to different divisions, and we are interviewing for candidates for the Deputy Health Officer of Community Health Education and Promotion this week. So hopefully next week or next month, I can bring someone in and introduce them to you. Starting with community health, there's pretty status quo with the services and provider things that are being offered through there with our MIHP service program and our community, or excuse me, Children's Special Healthcare Services. Those are on. We are fully staffed again. We had 2 social worker positions over the last couple months that were open and vacant in our early on program. So those are full as of this week, actually, this week or last week. So we're able to be out into the homes and working with those early on kids. Where a lot of activity is happening is in our teen programs and our Empowering Youth Today. There included a bunch of pictures on the next 2 slides. They are in their 6th or 7th week of programming, I believe, and so they meet Tuesday, Wednesday, Thursday, right downtown here across from the Y at the church there. And we have over 50 youth aged 10 to 15 involved in that. We have 13 summer staff positions filled to do that, and they have like two more weeks yet left. They are doing things like every Wednesday, I believe it's a community service learning day. So once a week for sure, they have something where they go out into the community. They've picked up trash in the parking lot and areas at Lifeways. They have worked at the animal shelter. They went over there and I think helped and at least got to see the animals and stuff, and then helped out there. They went to a Vista Grand Villa and worked in their intergenerational garden there. So it's fun. The 2 staff members that work directly with that program are exhausted. But it's been fun to see and see the pictures of the kids doing fun stuff. So our teen pregnancy prevention coordinator is busy working on summer programming and also assists some with the teen. Her teen advisory council helps with the Get Real program as well. Hearing and Vision has wrapped up its services for the school year, so that should be the final numbers for the 2021-22 school year. As far as what services were provided and how many children were referred. You'll see at the end of the report, July is actually Hearing and Vision Month for the health department. It's not a national month or anything, but we designate a month or a topic every month to promote different programs within the community. So last week, I talked about Hearing and Vision on JTV. We'll try to send out some additional press information and social media posts targeted on hearing and vision, especially as we, go into next month, which we focus on immunizations, but all of that back to school stuff where the kids have to have their hearing and vision screenings before kindergarten, so. Personal and preventative health services, you'll see, this is where WIC has now moved to, so the WIC program information is now in that program. A lot of information, or a lot of time has been focused on, I have a couple of these flyers and they're going out to the community, but we have Project Fresh coming up. I believe I've mentioned it before, but we are trying to take Project Fresh and make it even bigger and better than we've been in the past. We're actually going to have local farmers come to the health department. We have 3 different dates, 7/27, 8/3, and 8/10, 2 in the morning, early afternoon, and 1 towards the evening. That will, we didn't have this flyer available when I did the report, so otherwise I would have included it. But we have not only the farm vendors will hand out their Project Fresh coupons, but we have Smiles on Wheels will be there, kind of all in that effort, again, of promoting that back to school. So our immunization staff will be there. Hearing and vision can do testing within their clinic. We have Imagine Planet, which will have animals. I guess they have snakes, and we've asked not to have snakes, but little reptiles and animals that they can. So our WIC clients and anyone, we've opened it and trying to promote it to the community as well, to come out and get, those services needed. Or, just we can, we're encouraging our staff to go out and buy fresh fruit and vegetables from the market providers at that time as well. But the goal was that each, if we can get our WIC clients to come in, if they come in to pick up their Project Fresh coupon, not only then they don't have to take it away and go find another farmer's market to use it, but they can use it right then and there. And we can, answer questions, how they may use a vegetable or something like that as well. We'll have our dietitians available there. So that's their big, it's WIC, but it's including the whole health department. We really have many areas of the health department working on that. Clinical services, you'll see and have heard, our sexual health clinic is busy, and so they continue offering their services. Communicable disease, we've had 19 cases of food and waterborne illnesses since the beginning of this year, so we have all of that investigation. So our communicable disease staff has been able to, transition some of their focus from COVID-19, but transition it to, all the other different communicable disease that still continue to go on in the community. Another one of those that we are watching is the monkeypox virus. I've just heard this morning that there are 13 confirmed cases of monkey virus in Michigan. The good thing about this, if you can say good thing about a virus, is that we don't, it's not as easily transmissible as an airborne virus like COVID. So this has to be skin-to-skin contact in order for the transmission. So, but it is something we are, watching and trying to make sure we educate and help inform, give updates to the healthcare providers in the area. On that note as well, with healthcare providers in the area, to go back a second, we had a press release go out recently about the lead and the changing of the lead testing criteria that went from 0.5 down to 0.3 as considered a high lead count. And we have recently been able to restart testing, lead testing within the health department with the lead Care 2 machines that were previously on recall. So lead numbers and testing numbers in, actually all over the state and the country have been down because the primary machine that most places use to conduct a lead test was on recall. And it was actually the products used with the testing machine. So now that they've eliminated all of those, and those are all actually shouldn't even be used anyway because they've passed their expiration point, we now have the ability to order new supplies and do new lead testing. So working with the hospital as well to make sure all of their providers know what we're doing with lead and lead testing and that's available through us. So that's a big focus of us right now too. Environmental health, Work continues. Food safety side is very busy. We are still down a sanitarian in that department. We have posted a job for a casual position to kind of fill in temporary, but it's a difficult one to get someone, that part-time temporary position because it requires a licensed person that meets the licensing requirements for a sanitarian to do that. So, but they're busy. All of our food licenses, fees were collected and nothing is outstanding anymore. Arbovirus, we've had 5 surveillance sites that are 100% active. We have no, with both arboviruses that we watched, the EEE and the Zika virus, we've had no detection of anything here in Jackson area. Our actual mosquito collection has been down previously because of the dry weather. We'll see with some of the the rain if our numbers go up, but I actually have an update on this Arbor Village Park. The well is in. The well is in and working, and they are working on the distribution. The second kind of project that was in there was a distribution system, so they can shut down one area instead of, when there's a problem in one area of the park, to have to shut down the whole park. Now once this distribution system gets going, but they're working on that now, so I figured Commissioner Pileski would be happy to hear that. And I already mentioned that public health, you're kind of in my spotlight, the last one there, that we are working on the hearing and vision as promotion for July.
Questions for the Health Department? Commissioner Beer.
Good afternoon, Kristen. Got a call from a constituent that I'll pass their question on to you. People in Jackson are receiving calls from a Louisville, Kentucky health clinic, and it appears that health clinic in Louisville has health records of Jackson County residents. Why is that?
I have no idea. This is the first I've heard of it, so.
It's a what?
It's the first I've heard of anything like such as this, so.
Okay, if you look into that and get back with everybody with an answer, because constituents are receiving calls from Kentucky about
You'll need to gather some information from your constituent you'll need to get some pretty specific information from your constituents so to help them try to track it down. If they're not aware of it, you're going to need to gather.
Well, do we have an association with this health clinic in Kentucky? It appears we do.
No. We would have no, we have no, yeah.
Okay.
We have no affiliation or direct partnership with anyone in Louisville, Kentucky, so.
Okay, because a constituent called, somebody asked about their 6-month-old child, was concerned about their vaccination status.
Yeah, my guess is that it's a scammer trying to get information. But, we did early on when I first started with the health department last year, I know there was some scam stuff going on with COVID and people identifying themselves from the health department. If it's something we do know the information and can at least provide the right guidance on what to avoid, we can send something out and we can promote that, through our social medias that this scam is going on. But I have not heard anything of it and don't know anything of it. But my guess is that it is a scam.
Your guess is it was a scam?
Mm-hmm.
Okay. Thank you for that. Second item, I'm coming to the full board with some other requests relative to this. I think to be fully honest and open with our public, we need the other side of the story as opposed to all I see on a website is get the shot, get the shot, get the booster, get the booster. VAERS, Vaccine Adverse Events Reporting System, doesn't create any reports. They just compile reports from CDC, and they've documented just hundreds of thousands of adverse reactions. I would like to see something on our website that citizens can go click on and review some other sites that document the adverse reactions so that people can make a better, fully informed decision before they decide to get the vaccine. If only thing they ever see is get the vaccine, get the booster, to me that's not enough. They need to be exposed to the other side of the story as well. So
Are
is there
you
some,
making a motion, Commissioner Bear?
not at this point. I don't have enough documentation to go along with it. I've got access to some sites that have over 1,000 different doctors giving their reports on adverse conditions. I'll bring something to the full board asking for this documentation to be put on our health department website.
Okay. I have, thank you for the report on Arbor Village. I know that Don, I think, has been in touch with Eagle to make sure they continue to press for action. I know Eagle has a lot of things on their plate, but I know that Don has also been active in keeping them moving forward.
Yeah,
So
I
thank you
think
for that.
the, relationship, although we have no, oversight of
Right.
them, it's been good to stay in the know and know what's going on and help facilitate,
Thank you.
the parts.
With respect to the baby formula, I saw a report here with respect to the new, the plant being opened.
The plant is opened. It opened, I don't know the date now off the top of my head, but it opened, and then it actually had a closing for a short period of time. There was a flood in the facility.
Why?
But then it's back open. I think their primary focus, what we're hearing is that it's going to be until, fall, probably even late fall, before we kind of see that shortage ease up, because the production is going to take a while to get, back. They are starting with their specialty formulas, so things that babies who have difficulty with regular formula, trying to get those back in a higher quantity right now, because those are, when you have someone with, a picky need, and that formula causes, issues, then those are more pressing, because those are the harder ones to find, so it's not so easy to switch, so.
Any further questions for the health department? Thank you for being here, Kristen. Appreciate the work. We are up to the claims. Chairman will entertain a motion to pay the claims. I heard Commissioner Snell and Commissioner Alexander. Any questions on the claims? They are going around. All in favor will please say aye. Aye. Any opposed? Thank you. Please take note of other minutes. The DHHS board meeting minutes of May 23rd. That group also had a meeting just of last week to address their budget issues. I'm sure we'll see that soon. Reporting schedule for August. We have the Department on Aging, the Health Department, Lifeways, and RSVP Annual. In addition, I think we mentioned that we're going to add the medical care facility because they weren't here today. We are now up to public comment. Chair will entertain public comment. Public comment is now open. Seeing no rush to the podium, public comment is now closed. Committee member comments. Seeing no waving hands, we will now adjourn to the call of the chair. Thank you.